We have seen the boundaries and contents of the infratemporal fossa. Let us see the communications of the space. Communications are important in disease spread or tumor spread. We know that this is the infratemporal fossa. This is a medial, this is lateral surface of the lateral pterygoid plate, stellate process, infratemporal surface of the greater wing of the sphenoid, body of the maxilla. Between the body of the maxilla and the lateral pterygoid plate, there is a gap. This gap is called as pterygomaxillary fissure. Through this, medially, the infratemporal fossa communicates through the pterygomaxillary fissure with pterygopalatine fossa. If you go medially through the pterygomaxillary fissure, you end up in pterygopalatine fossa. That is the medial communication. Above, through the roof, it communicates. Under the zygomatic arch, the infratemporal fossa communicates with the temporal fossa. And we know that the greater wing of the sphenoid has foramina ovale, foramina spinosum here. So through that, the infratemporal fossa communicates with middle cranial fossa through these foramina, that is through the roof. Anteriorly, the infratemporal fossa, can you see this is the body of the maxilla? This is the inferior orbital fissure. We can see through eye also, that is the inferior orbital fissure. So the infratemporal fossa communicates anteriorly through the inferior orbital fissure with the orbit. The tumor or the disease here can go to the orbit. Posteriorly, we have seen that the relation is stellate apparatus and great vessels and nerves of the neck. Inferiorly, in life, the infratemporal fossa communicates with spaces of the neck. So infection here can go down and form neck space infections. These are the communications of infratemporal fossa. Contents are the lower part of the temporalis muscle, medial pterygoid and lateral pterygoid muscles attached to the lateral pterygoid plate. In the vessels, we have maxillary artery and its branches. Accompanying veins form the pterygoid venous plexus. There is a mandibular nerve and its branches. There is the otic ganglion and its connections. Each one of them is important. Apart from this, there is a cauda tympani branch of the facial nerve joining the lingual branch of the mandibular nerve, also as a content of infratemporal fossa.